And we're going to be ringing our bell soon. Woohoo! It was great to be your greeter today, folks. May the
Thank you
force
so
be
much,
with you.
Beth. May the force be with you too. Well, welcome everyone. You are here with the Rotary Club of Harrisburg, and we're excited to have everyone here. Our fourth virtual meeting. Seems like a lot's going well virtually for all of us, so thank you for coming out. It's great to see everyone here, and even Rotary International. Unfortunately, we canceled the Hawaii Rotary International Conference, but they are doing it virtually this year. June 20th through the 26th. So keep that in mind, and you can log in, and it's free for everyone this year. So they're trying to give a little bit of the Rotary International Conference there. And thank you, Beth, for doing the greeting. That was an awesome job. As far as housekeeping, please, everybody's using the chat. That feature you can use all throughout the meeting. Feel free. You can send private messages to everyone. Love to have them. And right now, did I see Will join us? I do see Will. You're going to give our invocation.
Yes, I am.
Thank you.
Let us pray. Let us give thanks for our friends and family, for this Rotary Club, and for Rotary around the world. Let us especially thank the men and women who daily put themselves at risk to keep us safe. Thank you for those who work in hospitals, fight fires, police our streets, and serve in the military. May we all survive this terrible pandemic and remain grateful for our many blessings. Amen.
Amen. Adeline, do you have a song for us today? Truly beautiful. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. How beautiful was that? Thank you, Adeline, for finding that. Makes you want to cry. If we can't have Norma playing the piano and Doug, Karen, or Karen Paris singing, that took the place. Thank you so much. How beautiful is that? So we have some announcements today. Can we get a screen share up there? Am I missing it? There we go. So again, we love to thank our corporate members for supporting Rotary, Capital Blue Cross, UPMC, Highmark, Hospice of Central PA, Goodwill, and the Chamber, Harrisburg Regional Chamber. Thank you to all our corporate members. And to all those essential workers out of there, our district reached out to Andy Rebuck. So thank you, Andy, for saying thank you in a most memorable way to all of those essential workers out there. I understand there's 10 billboards throughout Lancaster, York, and Harrisburg. 7 of them are approaching hospitals. So what a great way to thank our essential workers. Thank you so much for doing that for us. And as always, our Rotary Foundation, every Rotarian every year contributing $100. We pushed it out to May 11th. And again, we have a wonderful donator. I won't mention names, but Andy Rebuck. We're going to do a drawing. So if you can get your contributions in by May 11th, we are going to draw for 10 billboards on May 18th. So if you can do that, I believe right now from our board meeting we had this morning, thanks all board members, we've collected $49,534. We would love to break that $50,000 mark. So please be sure to get your contributions in. Adeline's made it very easy. You can hit the donate button on our webpage there or call that 866-9-ROTARY to get your money in. That would be great. And these are the billboard drawings, and our lunch money is going to the Central Pennsylvania Food Bank this time. So thank you to everyone. And some of our members, the lunch money is not included in your Rotary funds. So if you don't mind, if you'd love to make a contribution, please go out onto the Central PA Food webpage and you can donate now. Thank you so much. And with that, we have a Meet the Member. Gillian, I love that porch swing. You look so relaxed. Are you ready for us?
Hi, everyone. It's good to see everyone here. I love the amazing turnout that we have for these virtual meetings. It's really inspiring and encouraging. So I'll start with a little bit about me. So I know everyone can tell I have an accent, but I was actually born in Holland, raised in England. I went to boarding school in England. I studied art history as an undergraduate. And after that, failing to sort of get really inspired by the art industry in England, I decided to move to South Korea. Where I taught English for several years. It was a short-term visa situation, so every couple of months I had to take what we called visa runs to different places. So I got to really explore that area of Southeast Asia, and I went to the Philippines, Japan, Malaysia, Thailand, and my favorite, Cambodia. Spent some time at Angkor Wat, pretending to be Indiana Jones, exploring the incredible temples there, and it was a pretty amazing experience. The death of a close friend who I shared a house with in Korea led to a different journey, a 6-month journey through India and Nepal. This friend had been writing a book about Tibetan Buddhism, and that kind of inspired the trip and informed the trip as I made my way around there. After that, I moved to Taiwan via Hong Kong and lived there for 6 years before returning to London to complete my master's in Chinese at the School of Oriental and African Studies, or SOAS. which is where I met my now ex-husband. After living in Beijing for a couple of years, we returned to Camp Hill, which is where he grew up. Otherwise, I don't think Central PA would have been on my radar screen, but I love it here. I'm the executive director of Girls on the Run Capital Area. I think you've heard me speak about it. I've been there since 2014. And, you know, I think this pandemic has put a focus on organizations that really provide for our community in terms of their basic needs. But as we sort of move into the next phase of this, and Girls on the Run is going to play a really critical role, because our evidence-based social and emotional learning program provides a safe and a brave space for girls to discuss their emotions and process some of the trauma that they've experienced. So our role is caring for the mental and emotional health of our youth, as well as their physical health, is going to become more and more important. I am a Leadership Harrisburg graduate from the class of 2016, biggest and best class, of course. And I really joined Rotary for the relationships. I'm here by myself. I don't have family here. And the people that I've met and learned from through Rotary is really important to me. I'm on the Youth Community Development Team, YCDT, because I'm so passionate about helping our youth, and I think there's much we can learn from our youth as well. And YCDT is really amazing because the kids come from such diverse backgrounds and upbringings, and it helps break down stereotypes as they work together and learn from each other. And I think in our society, which is so polarized right now, that's critically important, especially when we think about these kids becoming our future elected officials, our entrepreneurs, our business leaders. It's important that they have developed empathy and a deeper understanding of what is going on in our community. So I feel really strongly about the work that YCDT is doing. So I live in Camp Hill. You can see me here on my porch swing in Camp Hill. I'm actually moving to Mechanicsburg to be in my kids' school district as soon as they finish or start actually building my house. So I currently live in Camp Hill with my two kids, Henry, who's 11, and Nola, who is 9, and a very silly rescue cat called Romeo, who is a real lover and has definitely helped bring a little bit of joy during this time. So yeah, that's basically me and my experience in Central PA in a nutshell. So thank you all very much. It's good to see you.
Well, great having you. Thank you so much for that. You do so much for our club. Thank you, and I'm glad you're here. And Ski, I know he is like chomping at the bit to talk there. So he put out there, he goes, where are you going to hold your next Girls on the Run event?
Oh, okay, wonderful. Thanks for asking that. So, like many organizations, we've been forced to sort of adapt to current circumstances. But one thing I'm really proud of with Girls on the Run is that there are 11 Girls on the Run councils throughout Pennsylvania. We have joined together to offer the Girls on the Run PA 5K Your Way. And that is going to be held between May 23rd and May 31st. And essentially registration is free. It is open to absolutely everyone. And the goal behind this event is to send a really powerful message about, you know, it doesn't matter that we're all kind of stuck at home. There is a way for us to move forward together as a community. And I would love all of you to register and participate. We are just encouraging people to run, walk, roll, skip, jump, cartwheel. And if they can't get out, just lace up their sneakers and participate in one of the activities or a line of activities from our physical activity bingo card. And all of these are available to you once you register. And, you know, it's important to us. The 5K, we've been hosted very generously by HAC for the last several years and had incredible events there that have attracted thousands of people. I mean, 6,000 people at our last spring 5K, over 3,000 of them crossed the finish line. And this is a way for us to, like I said, not only send a message to our community, but to our girls that you can still set a goal and accomplish it. And you have all of this support behind you as well. So please consider registering for the event and joining us between May 23rd and 31st. Thank you.
What a great cause. We have so many great not-for-profits in our club. So many. I can't mention them all right now, but one more that I want to make a special mention of. I'm sure you saw the roundup. You read it top to bottom, cover to cover. James diagonally, I think you mentioned at one point. But in here, we have LLS, and I see Nancy there. Thank you so much for bringing this to our attention. Nancy, do you want a minute and just kind of talk about what you're doing?
Sure. I just want to be sure that you all know that if you know someone with blood cancer, we have a special COVID-19 patient financial aid fund, and anyone with a blood cancer diagnosis is eligible to receive $250. You do not need a COVID-19 diagnosis, nor do you need to show proof of income. You just have to either have treatment scheduled, be in treatment, or in any kind of follow-up care by a doctor. So we have given away almost $25,000 in central Pennsylvania, which is awesome, but over 3 million nationally, and that's been in less than a month. And we have plenty more to give away. The important thing is we received so many calls from our families needing help. We wanted to respond, so we created this fund. Please spread the word. We want to be able to support as many families as we can with this assistance. So thank you for sharing that message. And
Thank you. Thank you so much.
Sure.
We're all doing so great with this virtual thing here, and I want to just, give a hand clap to Adeline. You're doing amazing with the transitions here. You're doing awesome. Thumbs up from everybody to Adeline. Thank you. Great job. So we're trying to go virtual here, and Adeline is really, looking at Club Runner and how we can make use of that program. So she wants to share a short video with us. Such catchy music there, makes you want to bob your head, right? It's great. And for those of you out there, no worries, we're not stopping the roster. The paper roster is still coming. It will still be in print. So no worries there. And since we have a little time, our speaker's going to be joining us here roughly 12:30. I think we need to point out some birthdays that are happening in this group. We had Adeline yesterday. And Ski today. Happy birthday, Ski. And we have Gary Britton on the 5th, as well as Colleen. So happy birthday to all of you. Does anybody want to sing happy birthday to Ski and Adeline? Wonderful, wonderful. Thanks, Ski. See the thumbs down. So Rotary is doing so much, even on the international level. They've put together a fund, a relief fund for COVID-19, and a lot of those funds have been depleted. So they're even looking for additional donations. So they're doing a great job with helping all over the world with COVID-19.
Today's speaker is Dan Jurman, who is the Executive Director of the recently established Governor's Office of Advocacy and Reform. And as Dan will readily tell you, he's personally experienced many of the issues faced by people who he hopes to serve. Dan was born to a teenage mom, never met his father, grew up in and out of poverty, experienced domestic violence, slumlords, and homelessness. He credits the programs and services in his community with helping him to overcome challenges and change his life's direction. As the first person in his family to graduate from college, Dan broke through the cycle of poverty, and now his passion is to help others do the same. As head of the Office of Advocacy and Reform, Dan intends to be a voice for the vulnerable and to also find ways to prevent the need for services by aiming efforts at making better use of existing resources and moving people out of the public benefit lanes. Dan states that if our early circumstances in life dictate our future, he wouldn't be here today. With the right partners, strategies, and hard work, we can give families of this Commonwealth the tools and the opportunities they need to create a better future. Dan is emailing me again, so let's see what he has to say. He says he's getting the same message.
Oh, he's on. Dan's on. I
Oh,
see
great.
that.
Here he is. Yay. Way to
Thank you for
go.
joining. I'm sorry about the little bit snafu, but glad you're here.
I will finish my introduction. Hi, Dan. Thanks for joining us, of letting everybody know that Dan's an adjunct professor and guest lecturer at Penn State, formerly adjunct professor at Lancaster Theological Seminary. He's formerly served as CEO at the Community Action Partnership of Lancaster County, where he was recognized by Central Penn Business Journal as in one of its inaugural issues as a game changer, and won an award for one of the most admired CEOs. He has been vice president for community impact at the Community Foundation of Tampa Bay and holds a bachelor's degree in literature from Rowan University in Glassboro, New Jersey, and a doctor of ministry with a concentration in poverty from Lancaster Theological Seminary. And if we could play a musical background intro for Dan's appearance, it would be that famous Phil Spector song that we all know, "To know him is to love him." Please join me in giving Dan a warm virtual welcome to our podium.
Thank you, everybody. Thank you. I apologize for the technical difficulties. You know, it's I don't know what we'll end up calling this age when it's all said and done, the COVID age or whatever it is, but boy, is it creating some interesting new technical challenges. I had the opportunity to do a guest lecture on COVID-19 and vulnerable populations for Penn State Hershey, and was asked to do that with some medical students. And it was the first time that I was speaking to a group, and for the most part, I couldn't see them at all. I could just see some boxes with names, and just giving a lecture without being able to see whether people are dozing off is challenging enough, and was a little nerve-wracking. And when it was over, the professor shared with me, it seemed to go pretty well. You know, the question and answer section went pretty well. And he said, there were about 400 medical students on the call. So I think it went smoothly. And I just thought, thank goodness he didn't tell me there were over 400 medical students before I gave the speech, because I might have chickened out. So I'm excited to be with you all. If I can, do I have the ability to share my screen with everyone? Okay, excellent. So I am going to share my screen for a brief PowerPoint. All right, we should be almost in business. There we go. All righty. So very quickly, the Office of Advocacy and Reform was created by Governor Wolf back in July of last year. And this came after a couple of pretty high-profile abuse cases in a couple of residential settings just some horrific stories of just cultures of abuse. You know, I'm a big fan of Drucker's work, and the quote that culture eats strategy for breakfast is one that stays with me. And so, you know, when you have a culture of silence and a culture of turning a blind eye to horrible things, then horrible things happen. And so the governor wanted to create an office that would be focused on reforms across the entire state, and that would be focused on protecting and supporting vulnerable populations. And that's a very broad mandate. Vulnerable populations goes everywhere from children who are receiving state services, people living below the poverty line, people with intellectual or physical disabilities, senior citizens, and folks who are in nursing homes. And so it's a big mandate, but a very important one. Our mission at OAR is, give me just a second here, let me adjust my screen a little bit. Our mission is advocating for all vulnerable people in our Commonwealth across all state government agencies, convenings, and communities to continuously reform our policies and procedures to achieve excellence in our outcomes and in theirs. Our vision is that Pennsylvania is a national model of equity, inclusion, and justice for and in the well-being of vulnerable people. And our values are equity, inclusion, justice, data and science, innovation, communication, accountability, and bravery. And I think bravery is one that stands out to me, in that when you're speaking truth to power and when you're telling people that the way we've always done it isn't the way we can keep doing it, it requires you to stick to your guns and to know where your values lie. Our structure at OAR was intentional. Governor Wolf wanted it located in the governor's office so that it would have the authority to make changes across all of Pennsylvania's agencies and departments. And so the executive director, which is me, answers to a deputy chief of staff over the health hub, then the chief of staff, and then the governor. So again, the idea was to have the weight of the governor's authority to make much needed changes to protect vulnerable populations. The team is me as executive director, and then the long-term care ombudsman, who had already been in place and working with the Department of Agency. She's now a joint report to the Secretary of Aging, and then with me. And she has a team of staff regionally, and then volunteers all across the state that can visit seniors in long-term care wherever they are. They have the authority to walk in, to talk to people, to find out what people's concerns are, and to investigate and work to make things better. And then we added a new position, which is the child advocate, which I hired our child advocate right before the coronavirus had us all staying at home. So we only got to work together in the office for a couple of weeks. But she's fantastic. She, in addition to having over 10 years of experience investigating some really tough cases of abuse and even child death in Philadelphia, she then went on to get her law degree. So she's an attorney as well as a social worker and child advocate. So just a fantastic person, and is already moving full steam ahead to create new initiatives and pilots where we can try to change the trajectory of what we've seen in child welfare in Pennsylvania. The governor also launched Reach Out PA, Your Mental Health Matters, back in January, and the Office of Advocacy and Reform has been a big part of that. We have been out to roundtables around the state discussing mental health issues with all sorts of stakeholders. I remember going to one roundtable in Chester County that was going to be at 6:30 at night on a Thursday, and it was cold and raining, and I thought, boy, nobody's going to show up. And it ended up being standing room only. And so I think the governor really struck a nerve in talking about changing the stigma and making sure that people who are struggling with behavioral health issues don't feel that they're re-traumatized by the stigma and feel like there's a path for them to reach out for help. Part of that is also insurance parity, making sure that we treat both physical and mental health equally through insurance coverage and access. Access also expands to having providers available. In a lot of the rural parts of the state, people find it very difficult to find a provider, even if they do reach out for help. And so the governor is working on What do we do to bring more people into the field, create more access through innovation in rural areas, and also create more access in our schools? The stigma issue, we are working on a campaign to destigmatize issues around mental health and to bring that out into the daylight. And then finally, adverse childhood experiences, or ACEs, which is a study from the late 1990s, where Kaiser Permanente and the Centers for Disease Control actually did a study involving people who were middle class and upper middle class, and found that the more adverse childhood experiences that they had as a child, and those include different types of abuse and neglect, household dysfunction, and they came up with a list of 10 within the survey, and they found that the more of those that people experienced as children, the worse their health outcomes were as adults. And not just in ways that, that you might think are very predictable, like substance abuse, suicide, cancers from smoking, but also things like heart disease, high blood pressure, strokes, cancers that have nothing to do with smoking cigarettes. All of those have higher incidences for people who've experienced childhood trauma. And it's helped to kind of use brain science to make a connection between traumas that we experience and what's happening physically to our physical health as a result of that. So we're doing a lot of work around that in the state of Pennsylvania. One of the things that the governor asked us to do at OAR was to make Pennsylvania a trauma-informed state. And so that work has begun and has thankfully not been interrupted by COVID-19. The first thing that I decided, having to have this mandate fulfilled by my office, was, boy, I need a lot of people smarter than I am to help me get this work done. And so I reached out with through a press release to put a think tank together of leading edge thinkers who have been really pushing the envelope on this, experts in their fields. And I wanted people from all different disciplines, psychology, education, the medical field, law enforcement. And I said I wanted to put together a think tank of 10 people. And I thought, boy, I hope I get 10 or 15 applications so I can do this. I got 68 applications from people from all over the state. And so I ended up expanding the think tank to 25 people. I've got a superintendent of schools, someone who does research on child maltreatment for Penn State, who's a PhD. I've got someone from the Attorney General's office in law enforcement. I've got doctors, pediatricians, psychiatrists, counselors, you name it. And I've got them from urban, suburban, and rural parts of the state. I actually had to look a couple of towns up just to see where they were on the map from some of the people that applied. And we have people from every ethnic group. And we also have people who, several of them have shared that they're survivors of trauma. We have survivors of domestic violence, rape, child abuse. We even have a survivor of a school shooting on the think tank. It's been amazing. We've gone through 5 meetings now. Since they're from all over the state, they were already going to be Zoom meetings anyway. I'm just much better at it now, given the times that we're in. And so it's been incredible to do this work with them. And we have a plan to make Pennsylvania a trauma-informed state that we're formulating together that we'll be releasing in July. The other thing I'll say on that is with COVID-19, we're actually all being traumatized, every Pennsylvanian, every American, all the different levels, depending on what kind of resiliency factors we have in our lives. But we're all experiencing toxic stress. We're all wondering whether or not we're going to get a paycheck into the future, whether we're going to lose our homes, whether we'll be safe and healthy, whether our children will be healthy. And these are questions that people living in poverty and other traumatized groups ask every day, every year, whether there's a pandemic or not. And so in addition to this work being important now for every Pennsylvanian to recover from COVID-19, I also think it builds a lot of empathy for all of us to understand what trauma does to us and what it does to us both mentally and physically when we're in it every day, because we all have a set threshold for how much trauma, how much stress we can take in a day. And when we go past that, then it starts to become difficult for us. For COVID-19, we have been working daily on taking complaints for seniors and their families. We've been trying to adjust how we investigate. So we're investigating virtually, having people walk us around with tablets so we can see what's going on. setting that down in front of a senior so we can do an interview, find out if everything's okay, talk to them directly. We actually are partnering with AARP and getting devices and smartphones and tablets to send out to more senior facilities and to seniors to make sure that all seniors have access to their ombudsman and can complain if something is not up to the standards that they expect. We're also looking at youth and congregate care, and actually with both seniors and youth, we saw a problem where college students who were social workers, who had social work students who had internships or field placements, those field placements closed, many of them, as a result of COVID-19. And so we're actually trying to pilot a program where we can help college students who are studying social work be able to be contacts for seniors and youth who are in congregate care so that we can help combat social isolation. And so that's going on right now. We're also very involved in making sure when there's an outbreak of COVID-19 in a nursing home that there is a tactical team that goes in and provides technical assistance immediately to try and make sure we have better outcomes than we've seen in other states since this has begun. And then finally, again, that whole idea of toxic stress. And so we're trying to make as many resources available as possible through our Facebook page and other avenues to make sure that people have tools to manage the stress that they're feeling right now. I know I have 3 children who are at home doing virtual learning at the same time. I have a middle schooler and 2 elementary school students, and it is stressful, and it's more stress on top of all the other stress that we have right now. And so, you know, I'll find myself being a little bit shorter with the kids sometimes when my own stress threshold has passed. So those tools to kind of de-stress, to get together as a family and talk through what you're feeling. We're putting a lot of those out right now. We are very concerned about increased rates of domestic violence and child abuse while these stay-at-home orders are in effect. And so we're trying to both make resources available and also equip people to kind of keep an eye out for the people that are most vulnerable in their families and in their communities. And that's it. I'm going to stop sharing and open it up for any questions that folks may have.
Dan, your presentation was amazing, and I'm so sorry our question and answer period got a little tough there with making you type. You did a great job hanging in there with us. We thank you. And what we do for our presenters is we have a book that is all about the state of Pennsylvania that we provide to 2nd grade. So we are going to put your name in that for you, and thank you again. What a wonderful presentation. So grateful you could join us. Adeline, when you're ready to ring the bell. Thank you, Dan. And we will see you next week, everyone. Thank you so much.